and we don't understand vitamin D in its proper entirety. And if you're watching this today, you are going to become an expert in vitamin D to the point where you're going to annoy people because you're going to know a lot more.
Yes, we need to change the general recommended dose of vitamin D for everybody. But also, if you're trying to take control of your health, it's really important that you are testing yourself and taking all of these other factors into consideration, because the optimal dose for you will change based on several different factors.
These two professors came back and they actually looked at the data that the committees had put together. And when they looked at it, they said the statistical evidence was off by a factor of 10. The Sunday Times doing a 40-page article is a big thing, right?
Oh, yeah. You know that's a big deal.
Yeah, because the thing is with vitamin D and dosaging and taking it, it's that why. It's like if you don't know the why, because if someone says to you, take this, you're like, why? That's what's not being explained. Like
Well,
everyone,
that's the case with everything.
yeah, but everyone. You look at all the videos now, the content around. Every person's explaining vitamin D in the research, but they're not giving the why you should be taking it, the actual factors of it. So like,
But I don't think they're actually explaining it properly, because we're still talking about it like as a vitamin. And so you're kind of, when people talk about it as a vitamin, you put it into the context of like, you know, your B vitamins and your thing, all of those things that we all know we should take, but like most of us probably don't get enough.
Yeah,
Whereas
yeah.
actually vitamin D, particularly in the context of the world today, is really, really important.
Yeah. I mean, okay, we just got to get into it. Everyone, thank you for joining us today. This is one of the recordings that just had to happen. We've been debating on this for the last like couple of weeks. We're like, should we do it? Should we not? What should we say? What topic should we cover? And I think this is definitely going to be like a 3 or 4 parter because it's deep.
Oh, like 10-parter.
Yeah. But we're going to get into vitamin D. And honestly, this is going to be, because everyone knows that if you've heard me like lecture, or you've heard like our webinars or been on our Instagram, I've talked a lot about vitamin D because of its regulation of the immune system, but it plays such an important role in histamine as well. And I think many people think just a vitamin D is that bone health supplement.
Yeah.
But we don't understand vitamin D in its proper entirety. And if you're watching this today, you are going to become an expert in vitamin D to the point where you're going to annoy people because you're going to know a lot more. So I am really excited for this chat today. I'm really excited.
I know you are. Vitamin D is your thing. So I'm just going to let you run wild.
I hope not too wild, because you know we don't really get controversial and get cancer now, do we?
Okay, so we have a lot to get into.
Yes.
So let's jump right in. So I think that we should start with, you know, what is vitamin D and what role does it play? So let's just give a little bit of a background.
So vitamin D is not a vitamin. Vitamin D is a hormone.
Dun, dun, dun.
We've classed it as a vitamin for some strange reason. But if you actually look at what vitamin D does in the system, what it regulates and the function it controls, and you actually look at it from its molecular structure of it, it's a hormone. It's synthesized by the body. And when you get that into your head that it's not just a vitamin, it's actually a hormone that our body needs, and I can't emphasize this enough, needs, it will be a game changer for you.
Well, I think it's interesting kind of to add a little bit more weight to that idea of it as a hormone as opposed to a vitamin, is the fact that, yes, there's trace amounts in food, but they're usually coming through from the sun anyway. The fact that your body has the ability to synthesize this vitamin or hormone from the sun categorizes it a little bit differently from your standard vitamins and minerals, which are found abundantly in food. Whereas this is a little bit different in that you can see from the research that the body was designed to synthesize this from the sun as opposed to take it through food. I'm probably going to get a lot of kickback on that. Look at the research. Most of the vitamin D that you can get through food, it's not going to bring you to the place that you need to feel
The statistics
a benefit.
are low.
So just to give that context.
I mean, the percentage from food is very, very low. But like to kind of go back to where you said about the sun, you've got to think about our skin synthesizes vitamin D. Our physical, we have cholesterol that pulls that vitamin D from that sunshine. And you've got to remember, it's not the UVA rays we need, it's the UVB rays. So to synthesize vitamin D...
So explain that. So to get the UVB rays, you need to be in the sun between 12 and 2.
That's right in what you just said there. Vitamin D is synthesized in the skin, and it's the UVB rays we need, not the UVA rays. And to get UVB rays, it's between 12 and 2. And that 12 and 2 is really, really important because that's when UVB rays are actually coming through. But it's also the point where we hide from the sun. And so a lot of people, because we're in our offices, we're trapped inside buildings, or people run because it's the hottest part of the day, because the sun's at its highest meridian, we kind of veer away from it. And that is where we get a lot of problems from.
So what are the functions then? What's the role of vitamin D in the body?
So vitamin D, the main primary function that everyone thinks of is purely for bone health. We talk about the idea that vitamin D gets, it pulls calcium into the bones and it keeps that bone health really density strong, and it stops those bones from becoming weak. That's the main kind of primary focus. But if you actually look at where the vitamin D receptors are in the body and how the vitamin D receptors function, it's more than that. It's vitamin D plays a role in our muscle growth, in our cell growth, how our cells actually physically function. It's part of our genetics. And vitamin D plays such an important role in those areas. It was only in the last 2022 where they discovered vitamin D had a process in mental health, that our physical psychology of it. And
hormonal health.
Don't even get started on hormonal health, because that in itself is an entire topic in itself.
Immune health is another one. I'm just trying to think of like all of the different areas. I mean, essentially it plays a role in almost every different system in the body, either directly or indirectly. But just some of the key players, as you said, like I think mental health is a really big one coming out, because we are seeing a lot of suboptimal levels of vitamin D deficiencies. I think we're seeing vitamin D coming into the light in a lot of places, but particularly mental health, hormonal health. We're seeing it a lot in the menopause community, and of course immune health. So it's a really, really big topic of conversation post-pandemic, really big topic of conversation in the allergy and immune world and things like that. So
it's because you talk about the immune system. What we don't understand is that vitamin D is the link between our innate and adaptive immune system. Our innate immune system is the immune system that we're born with. That's what we've all got. And vitamin D is what supports that regulation of the adaptive immune system. So that's the immune system where our body's exposed to all these viruses and bacteria. And you hear about like, oh, it's okay, I've got the cold or flu now, and my body like will get used to this and it'll get used to this virus. Vitamin D is what links that.
And it's not magically happening.
And vitamin D is what is literally brings that immune system back into balance, because when you come into contact with that virus or with that infection, vitamin D is helping your body to fight it. It's part of that white blood cells. And just to kind of raise this topic, I know it's slightly off topic, I just want to say this, but remember, it's not about having an overactive immune system or an underactive immune system. It's about having a balanced immune system, and that's what vitamin D does. It balances the immune system.
Yeah. It's like basically either end of the spectrum is not beneficial or healthy. You really want to be like in the middle, and vitamin D is helping with that regulation. So something that you actually taught me a lot about, and it wasn't something that we learn very much in clinical practice or coming up in university, is the history behind vitamin D, and particularly how we came to decide, what the vitamin D levels are that we should be taking, what are our RDAs, our recommended daily allowance for vitamin D, what's the upper tolerable limit, things like that. You have a really interesting story about the history of vitamin D in this country in particular. So I would love you to just go off and share that, because it's fascinating.
To fully understand vitamin D, we have to understand its history. We have to say where it's come from and why there's so much conversation around it happening now, and why it's become in the public light so much. So vitamin D has been like the actual understanding of it has been around for 350 years. And I've got to say this with like, it's so incredible. The UK has been pioneering a lot of vitamin D research. And since 350 years ago, we were really, really into it. We were so into it. We used to have in the 1922, there was a committee on the biological actions of light. That's literally how much we placed an emphasis on vitamin D because we wanted to understand it. And there was a professor called Professor Sidney Russ, and that was around. I'm just going to check the date because I don't want to make a mistake there.
1879 to 1963. I have the dates here.
Oh, wicked. So yeah, date. So 1879, 1963. Professor Sidney Russ, he was with like a conglomerate of hospitals, and what they were doing is they were looking at vitamin D, but they were also trying to understand radiation. So they were trying to understand
So they knew that there was a benefit to vitamin D at this stage, but they were trying to investigate it further.
Yeah, because they wanted to make sure that if we were getting the vitamin D from the sun, how could we also protect ourselves for the rays that we didn't want?
Because they understood that the sun is a producer of radiation, so there must be some backfire in a sense.
Yeah.
So trying to understand that balance, really.
Well, it's like yin and yang, isn't it?
Yeah.
It wasn't until like the 1920s when we actually really got stuck into vitamin D, because it was only until the 1920s we discovered vitamin D receptors. And it was like the light bulb moment. If you read the papers, and I'm going to link them in the description, there's a timeline in history of vitamin D where I'm taking this information from. That eureka moment kicked in when they discovered vitamin D receptors, and they realized vitamin D played a larger role past rickets disease. We knew it from rickets disease, but it wasn't until we discovered the receptors and all the other functions, which we talked about before, that they were like, oh my God, there's more going on.
So pre-1920, they understood that the sun had a positive effect on certain diseases such as rickets disease, bone disease, things like that. But you're saying in 1920, they discovered that actually we have receptors for vitamin D, which we're getting from the sun. And so that kind of sparked investigation into, okay, shit, if there's receptors here, then it must be doing a lot more than just supporting bones. Okay.
Yeah, so that was basically it. So to then continue the story, Aaron, can you just switch to the photos, please? I have to show you these photos. So this
photo.
Yeah, I love these photos, and you can see you share them on the screen now, and everyone can see them, right? So this picture that I'm showing you is something called sanatoriums. This is how awesome the UK used to be in natural therapies. And so sanatoriums were around the entire of Europe, and in the UK we had them all over the country. And what was incredible about these sanatoriums was the therapies that we got from them.
Yeah.
And in the 1928, the image you're seeing, this was from an article, so a 40-page article in the Sunday Times. And and I know, Tracey, you've been in media. The Sunday Times doing a 40-page article is a big thing, right?
Oh, yeah. That's a big deal.
Big deal. And what you used to do was you used to go to these centres, and it was all about sunshine therapy and activities and being in the fresh air. And the purpose of the sanatoriums was 4 things. So if you look at this photo and you go through it, you can see what they're doing there. They're out, their feet are in the ground, they're sitting in the sun, sunbathing, and they're as scantily clothed as possible.
Yeah.
They're doing yoga and exercises in fresh air, and they're getting it. And so
revolutionary.
It was basic health, right?
No, absolutely.
And so the 4 things that was purpose of these, right? They had the purpose of something called so there was heliotherapy. So heliotherapy was sunshine therapy, vitamin D, balneotherapy, and that was therapy from seawater. That was physically
almost like salt therapy in a way.
It like magnesium being absorbed and all those vitamins from the sea
all your natural minerals
in the system. And then there was something called air therapy, which was breathing in oxygen. So that was like teaching people to breathe in the actual physical air. So they knew about this in 1928. And
phytotherapy as well, using UVB lamps.
Yeah, so the phytotherapy is really interesting. Aaron, can you just skip one more photo across, please? Phytotherapy was so important because it wasn't just for kids, because they were using it part of rickets disease to use UVB lamps for the treatment of rickets disease. But in places like Bethnal Green, where you can see that photo, That was an entire family sat in a room with UVB lamps, sunglasses on, just literally soaking
Chilling.
UVB lamps. So you can see that in the 1930s, we were fully in that vitamin D from sunshine. So we understood it. And it gets more interesting. You can see that all these different therapies were playing a major role in the system.
It suggests like quite a fundamental understanding of the importance of vitamin D and how you can get it in nature.
Yeah. And Tracey, you're fully right. So let's push forward a bit now, right? Pregnancy and vitamin D. There was a famous doctor, Dr. I'm going to say his name properly, Dr. E. Oberma, and he wrote a letter to the BMJ, so the British Medical Journal. You know, I know, big journal. What Dr. Oberma said was he did a study across these 4 different centres. It was a 4-year-long study, and he basically started supplementing these women with vitamin D because he said there was like I think there was not in the article it says that they were saying that 1 to 2,000 IUs, and he was like, you're completely wrong. You need higher doses because it's just not enough. If you actually look at the data that's available, we can synthesize more from our skin. So pregnant women need, because their requirements, because they're growing a human, their requirements are much larger. And so he said, with his study, with his research, and this wasn't a small study, it's like 400, I think, 300 to 400 women that were in there. I can't remember the exact figure. He said for the first, up to the first 7 months, they must take 10,000 IUs. And then from month 8 and month 9, it was 20,000 IUs.
Yeah.
He wrote that and submitted that into the BMJ. And that wasn't met with any like problems or anything because he backed it up and he was testing this and he was seeing the health benefits that were coming not only from the mum but from the child as well.
Yeah.
And so what the problem that he actually saw was the fact that there wasn't testing available. So let's move a bit forward on. It wasn't until the 19...
So was that the reason that that never kind of continued long term in terms of recommendation, is because they couldn't test the levels of vitamin D in these women's systems?
Tracey, I'm going to be honest, I don't know.
Yeah.
It's basically, you read that article because it's a whole piece and I'll link it in the description.
Well, no, I've read the research. It's really good quality and it's really interesting. But I think the question is always, you know, why did that not carry?
Yeah, that narrative didn't carry. And that's what, when you look at the narrative, that was quite worrying, why it didn't carry forward. But then,
I think not being able to test would be a reasonable reason, because even though, I mean, one of the things with vitamin D that I always find funny, and I'm jumping ahead here a little bit, is the fact that you're a person with a light skin tone who is in the sun for 15 minutes will produce between 10 to 25,000 IU of vitamin D. So it's wild to me that the recommended daily allowance and the upper tolerable limit are so low if your body just naturally produces that quantity by going out into the sun, which is the recommendation for vitamin D. We'll jump into that deeper later in the video, but I think it would make sense that the reason you might not want to carry such good evidence into a recommendation specifically for pregnant women would be the inability to test, because you can't monitor those levels. You don't know, you haven't established a baseline. But anyway, yeah, I think you were going to start talking about testing.
No, I think what you just said that was really, really important, because it's something I think it's going to come up a lot in this topic of discussion. And so, yeah, vitamin D testing wasn't discovered until 1970s. And
there you go.
And when they discovered the vitamin D testing, we could then work out where the person's blood level was at. We could actually physically see. And, you know, as a clinician, talk to any clinician, testing is so important.
Yeah. Well, I think establishing a baseline is really important. You know, testing is a really, really good resource for multiple reasons, but particularly when it comes to vitamins and nutrition, I think establishing a baseline and then using that within the context of whatever symptoms someone might be presenting with, and then utilizing further testing so that you can monitor what the levels are after supplementing, and you can compare where your symptomology is with kind of bringing the levels up to what we believe to be a healthier place. So it's a really, really important, and also it's it prevents you from over. I don't want to say overdosing. Can you say overdosing? That's more kind of drugs.
they call it vitamin D toxicity.
Yeah, but you can. I'm just talking like with nutrients or supplementing in general. It's really important. It kind of just helps you monitor, and then you understand what levels do you feel you're best at, and then you can kind of keep an eye on that so that you're keeping yourself topped up.
Yeah, I mean, you're completely spot on with what you're saying. What you just said there, so let's add to it, because I think this is the point where we add to it. You said upper level limits, and you mentioned it before about upper level limits. So let me bring you to 1977. So 7 years after we discovered vitamin D testing, there was a Professor Stamp and he was part of a group of doctors, and they started looking at establishing how much the skin synthesized. So we actually learned in 1977 from Professor Stamp's research. It's been, every study links his research. They talk about what he said. He looked at the dosages of vitamin D levels from the sun because they wanted to understand how long it took the skin to burn. And he said, I'm going to quote this if I'm right. He said the skin could synthesize anything between 10 to 25,000 IU in a third of the time it took the skin to burn. So your skin could absorb that. And they actually used that via testing. So they tested that hypothesis to see how much the skin was absorbing of vitamin D from the sun.
So your skin almost has a natural, what's the word? Jesus, I didn't sleep enough last night. Baby girl was up all night and my brain is not working, so apologies. So essentially your skin has an inbuilt system of allowing you to synthesize enough vitamin D from the sun within that window before your skin could ever start burning or gain damage from the sun. So that's quite interesting.
So your skin takes it takes about 30 minutes to begin sunburning, and in 20 minutes, you should be able to synthesize in your skin, as long as you're fully unclothed, anything between 10 to 20,000 IUs, depending on the color of your skin.
Yeah, I was going to say there's like slight differences depending on the color of your skin, because obviously the lighter your skin is, the more easily and prone it is to burning, and the darker, the less easily and prone it is to burning. And you will need like a little bit longer in the sun to get your vitamin D levels with darker skin, and then a little bit less with lighter skin. So before we get into the theory behind why the guidelines around vitamin D are what they are, I really want to quickly go into why you get so excited about vitamin D, because really this vitamin D is your topic. Like, you are so educated and so passionate about this vitamin, or should I say hormone, and I'd love for you to share the reasoning behind that, because I think it's really lovely.
It all started with a close personal friend of mine, Dr. Lars von Olschig Albeheim. He passed away, so it's a bit of a sad topic, really. Really incredible doctor. He actually is one of the people that brought me into Toxaprevent. He's one of the guys behind that actually brought us into Toxaprevent and really pushed my knowledge of it. And he was really passionate about vitamin D. And when I first met him in 2016, he had just started research on vitamin D testing. And I remember we were in Germany, and we were in Berlin at the time, and he disappeared for like 3 hours. And I found out he'd gone for a meeting with a medical device company to help build this device. And he was
rapid vitamin D testing.
Rapid vitamin D test. And we were sat down it was in a bar, right? And he bought the machine, this like about a year later, and we were sat in the bar and he tested my vitamin D levels. And I still remember my result came up 7 nanomoles per litre.
Ooh.
I was low, right? And
How are you still functioning?
Yeah, but at the time, like, we wasn't functioning. Like, I'll be honest, I wasn't functioning. If you know me from the past, I wasn't functioning. And Lars showed me the results, right? And I remember him looking at me and saying, "That's really, really low." And he said to me, you need to take vitamin D, 10,000 IUs every single day. And I remember the words, he said to me, take 10,000 IUs every day. And he spun me into like vitamin D testing because I'm not a clinician. And, you know, I've never claimed to be a clinician, but he showed me the door to vitamin D. And then when I started understanding why we should be testing and why we should be supplementing and how important vitamin D was, it just blew my mind. And Lars's discovery of rapid testing changed everything because he actually discovered that vitamin D will fluctuate between 10 to 30% per day. So if you test on like a Monday and you go to a lab to get your results and it comes on a Thursday, your vitamin D is fluctuating between 10 and 30% already.
Yeah.
So what he said, he created the rapid test because he wanted to make it accessible.
Yeah.
Because his ethos was that every single person should be able to readily get tested for vitamin D because of how important of a function it was in the system.
Accessible, but also convenient, I think.
Yeah.
Yeah, yeah.
100%.
And particularly when you're adding the research around, you know, this idea of 10,000 IU per day, which we will get into. I mean, I imagine back then when you discovered you had 7 nanomoles per litre and he was telling you to take 10,000 IU a day, you were probably like, what the hell? That's insane. Because the normal recommendation is significantly less than that. So, yeah, that's really interesting.
But you got to remember, I didn't understand recommendations.
That's true.
I didn't care for recommendations because I was more bothered by the research. I was coming from a data and I trusted Lars. So what Lars told me is what I went with because I knew he had done his research, but then he'd sent me the research to do. And that's where my passion started from, actually understanding it. And it's doing these presentations where I've picked up so much information and I'm quite fortunate. I've got a group of doctors around me who send me all this data as well. And I've got a really good team around me who support me with a lot of research. And honestly, there's so much research, you know, being able to read it and understand it and actually absorb it is crazy.
Yeah, yeah. Okay, so let's get into it. We're talking about all of this research. We've dropped the number of 10,000 IU a few times. It's something that comes up quite a bit. It's all based on this idea of the miscalculation. So everyone needs to know about this miscalculation around vitamin D and how it has brought us to today, where the average recommendation for vitamin D is 400 to 600 IU. But most of the research is suggesting that actually 10,000 IU is a more accurate level to be at. So explain this to me.
This is like a...
Just an easy question.
Yeah, an easy question to answer. So if you look at vitamin D, why it was disregarded as like 400, 600 IUs, there was, I think it was in 1991 to 1998, there was a group called the Committee on Medical Aspects of Food Policy, and they looked at the research that was around, and they established, based on statistical evaluation of the data, that the number to reach above a certain amount, so 50 nanomoles, which is what they believe to be a good level of vitamin D, to reach that point.
So the goal level for vitamin D was set at 50 nanomoles per litre.
That's what they set it at, because they said that anything under 25 nanomole was what caused rickets disease.
Yeah.
Right. And I'm going to emphasize this, what caused rickets disease. They didn't care about anything else, just rickets disease.
Not what optimized the levels in your body, purely below 25 is what caused rickets. Yeah, that's a really important.
That was their focus, right?
Yeah.
And so
how to avoid rickets.
Rickets disease, basically. And so they started fortifying foods. And what they said was, based off the evaluation, because I think it was like 32 studies that they'd graphed out. And they said, based on that, if you supplemented 600 IUs per day, so if you fortified milk, fortified food, or you supplemented 600 IUs a day, you could reach a blood level of 50 nanomoles per litre, right? That's what they based the data off.
Which would protect you from getting rickets disease. So nothing about this would support the functioning of your body. This is the optimal level of vitamin D. Nothing about optimization of vitamin D. Just this is the level that we believe will safeguard you against getting rickets.
Correct. And then they endorsed it in 1998. Fast forward to 2010, 2016, our committee in the UK looked at it as well. And everyone ascertained from that data, so not up-to-date data, this is from the data from the 1900s. Bearing in mind, I've just given you studies from 1922 and 1947 to give you those dates as well. And
Where they knew a lot less about vitamin D.
Where they knew a lot less.
Yeah.
Well, I don't know, Tracy. I think they knew a lot more. I think they knew a lot more about vitamin D. And basically, our Committee of Nutrition said the same thing. They said that 600 IUs is the baseline of what every child and adult should be taking. That's how much we need to bring our blood level above 50 nanomoles. And they stated categorically under 25 nanomoles is where disease is. And up to, if you supplement daily with 600 IUs, you will reach 50 nanomoles.
600 IU or 400? Because 400 IU is the recommended daily allowance and 600 IU is the upper tolerable limit.
The 600 IUs, that's what they ascertained. It was 600 IU was the upper tolerable limit that you should be taking to reach 50 nanomoles.
Yeah.
And the issue where
so actually, let's recommend even less.
Yeah. I mean, the thing is, if you read the documentation, which as you know I have, the problem that they had was they said they can't go higher than this because they don't know what the person's vitamin D they're being exposed to. Because they said, could they be getting vitamin D from food, i.e. mushrooms and fish, for example, take example? Would they get vitamin
Can I
D from
just
the sun?
say as well, food sources of vitamin D, in most cases, vitamin D is being added to the food source, or it's being added if you're getting it through animal, animal protein or whatever. They're getting vitamin D, synthetic vitamin D added to their food, or they're getting vitamin D through the sun. So just to put that out there, there isn't necessarily a natural source of vitamin D through food.
Yeah, 100%. And so their issue, as you said, was in the food because they were looking at the different sources.
But also the sun, I guess, because to be fair, when your body is synthesizing something from the sun, you can't control for how much sun someone is getting. So it's really difficult to actually give a recommendation about how much vitamin D you need to ingest.
Yeah, 100%. And that's the issue that they were having. So they made that 600 IU based on not knowing. They had to generalize it for every single person because what they were thinking was if we generalize it, then we're not going to get what they thought was vitamin D toxicity.
Yeah.
Because that's a topic we need to talk about, vitamin D toxicity.
But also the assumption kind of around that recommended daily allowance for vitamin D is really that you're also getting some sun exposure. So I think the assumption around that recommendation and keeping it lower is based on an assumption that you're also getting a lot of sun exposure, which as we know, is not happening, whether it's because you live in a northern hemisphere country where there is less sun, or like most people nowadays, you're slathering yourself in sun cream before you even walk out the door. A lot of people aren't actually getting that exposure. So I think that's, firstly, a big issue.
100%. To go back to this data, the research that they based their 600 IUs from, in 2014, there was a study done by Professor Ekwaru, and I'm going to say his name wrong, Rugelas. And basically, these two professors came back and they actually looked at the data that the committees had put together. And when they looked at it, they said the statistical evidence was off by a factor of 10. So who had ever done the maths on this had completely set the wrong baselines. And
so it was literally just a mathematical error.
It was a mathematical error. And what they said was, if you actually look at that study, it was more closer to get to 50 nanomoles, you needed 8,895 IU. By the way, I'm just talking about this. I'm going to link the study down below again. It's in the description. You can
Don't
read
take
it.
our word for it.
You could read it yourself. Yeah, read it yourself.
Yeah.
And so they had discovered it was off by a factor of 10. And this is the issue. The data that we've been given, if the original data is off and it's been incorrectly, statistically, read incorrectly, and then you take away the idea that we've not got accessible testing, everyone's vitamin D levels are going to be low.
Yeah.
because you're not giving people accessibility. Because you go to a GP and ask them for a vitamin D test, they're going to say no. They can say supplement 1,000 IUs, supplement 2,000.
Well, also, I think they're, particularly in the UK, they're under pressure because there's a lot of people that are requiring vitamin D tests. And so it's putting a lot of strain on having to get a doctor's appointment just to get a vitamin D test, which is why you'll notice actually in the last decade, they started outsourcing vitamin D tests. So now you can get an at-home vitamin D test through the NHS. So I think just to put that in context, it is too much strain to be putting on that surface just for vitamin D. But equally, we really need vitamin D tests.
And it's the cost of the NHS as well. And it's that cost of the NHS because they're just like, we'll just basically supplement. Just supplement blindly to get to where you need to be. But you shouldn't be supplementing blindly. You need to know your baseline. And you need to know if you're taking higher doses where it's getting you to. And I know this is a topic of conversation we're going to discuss today, isn't it, as well?
Yeah. Let's go on to vitamin D toxicity. So we've...
Vitamin D toxicity, this is going to be fun.
Because I think it's really important as part of this conversation. So we've established the challenges around how we've gotten to our vitamin D recommendations. If you Google how much vitamin D to take per day, you'll find that it says 400 IU is the recommended daily allowance, 600 IU is the upper tolerable limit. We've spoken about how they got to those numbers and some of the concerns and questions around this. But when you have this conversation, something that very quickly comes up is vitamin D toxicity, because we know that vitamin D is a fat-soluble vitamin, kind of like vitamin A, and there's a lot of concern around toxicity, particularly with fat-soluble vitamins. So can you talk a little bit about vitamin D toxicity, why we're so scared of it, and where that comes from?
Right. If you're standing up watching this, you need to sit down because I'm gonna blow your mind a little bit now.
Be nice.
I'm gonna be nice, but everything I say right now, I'm gonna link all of the research papers that I have read and everything down below, because to understand this and understand what I'm about to tell you, you need to understand where the research comes from. And I'm going to get my phone out for this one because I want to quote some of the papers here now, because vitamin D toxicity or overdosing has been completely blown out of proportion in my opinion, right? And before we did this talk, we were sat and I showed you some of the papers, and even you were like, okay, I see where your mind's going from here. One
of the biggest issues in today is that we're taking information from like 20 times removed from the primary source. We're just assuming that because someone is educated in an area that they know what they're talking about, or because someone doesn't have clinical qualifications that they don't know what they're talking about. So always check the research for yourself. It's the best way to know that you're informed correctly.
1000%. So the two most claimed studies is one by Professor Veith and Professor Jones, so Glenville Jones, right? And both of them very active in the vitamin D research. And
highly quoted studies. So in a lot of blogs or even meta-analysis or videos around vitamin D, you'll notice these two studies are highly quoted.
So to kind of get into this, the main quotes used in every single toxicity report is this. Veith said, excessive vitamin D intakes have, however, been shown to have toxic effects. That's the one quote used in every single paper. The one from Jones, vitamin D toxicity results in hypercalcemia, elevated serum calcium caused by increased intestinal calcium absorption and mobilization of calcium from the bone. That's Jones 2008. Now, that's what people quote. But before you quote these, because when I read them, if you read that, you're going to go, oh, crap, better not overdose on vitamin D.
Both of those statements are true, by the way.
Oh, they're both true.
Excessive vitamin D can do that. So just to put that out there.
But then if you actually read the studies, they've been completely misquoted and being completely taken balance.
Putting it into context.
Well, I'm going to put it into context now. So if you read the paper, start with Veith, for example, one of the next quotes is, the UK guidance level is not the upper level limit, but it simply states that the person should take 1,000 IU without medical supervision. At nowhere does it state that it's the upper level limit. They just say you should take 1,000 IU. You can take it without medical supervision.
Where did they get 1,000 IU?
That's the big question. Even he can't work it out.
So he's just suggested that actually you should be able to take 1,000 IU per day without any medical supervision.
Yeah. And then I'm going to quote him from the exact paper. The definition of the upper level limit is ambiguous, and it's based more on what it is not than actually what it is.
Yeah.
So that's in the exact same paper. My quote said this, right? And I'm going to continue with the quotation of this. He then continues to say the nutritional value for vitamin D should be defined as an amount of vitamin D equivalent to what an adult can acquire through exposing their full skin to the sun. And so that physiological intake from the sun for an adult might range up to 250 micrograms. That's equal to 10,000 IU.
Yeah.
So that's the same paper that's been misquoted.
The same paper that's quoted to caution about vitamin D toxicity is actually suggesting, if you read further in the paper, which a lot of people don't do, is actually suggesting that you need to be looking at about 10,000 IU.
Yep. And it's going to get even more funnier, right? He, in that paper, lists what the legal definition of an upper level limit is according to the medical health advisors, the legal profession, clinical nutritionists, researchers, and ethics committees. But one of the most funniest part of this study, and what made me chuckle so much, was that he said, if you read the published reports on vitamin D toxicity, it wasn't until the blood serum level reached 500 nanomoles per litre.
Yeah.
So look where 50 nanomoles is, 50 nanomoles is, to look where 500 is. Do you know how much vitamin D you need to have to reach 500 nanomoles?
Oh, probably like 1 million IU.
Yeah.
Yeah.
Literally a day.
Yeah.
Literally per day, you need 1 million IU per day. So that's the Veith paper. Let's talk about Jones 2008 because it came that paper out. This is the other misquoted paper. And the first thing he says is we surprisingly know very little about the mechanism of vitamin D toxicity. That's one of his quotes in his actual physical paper.
Yeah.
And he then talked about chylomicrons and the peripheral tissues. So one of the things about vitamin D is our body stores it. And what we know from the research, it doesn't store vitamin D until the blood level reaches above 40 nanomoles per litre. And our adipose tissues will soak up that vitamin D. So if you're really vitamin D deficient, it will drip feed it into the system because it wants you to function. And so he said, we actually don't understand how it's pulled into the skin, and actually we don't talk about how much our body stores in. And that paper really indicated this. And
so what you're saying is that if your blood levels are already in the range of deficiency, then you most likely don't have any stored vitamin D or very, very little.
You won't have any stored
because it's going to concentrate your blood levels first.
Yeah, because it's going to go, right, we need to use this vitamin D. And like you eat some mushrooms, your body's just going to literally utilize that little bit of vitamin D because it's not
Which is why
it.
you have to be really careful when testing vitamin D that you're not supplementing with vitamin D, and that includes any of the foods that you regularly eat. You need to be checking your cereal boxes, your bread ingredients, mushrooms, meats, things like that. You need to be really careful about what you're eating in the lead up to a vitamin D test, because if you're deficient, it'll throw that straight into your bloodstream, and then it could give an error in calculation as to what your actual levels are like.
Yeah, completely right. And okay, I'm gonna just give you the last bit breakdown of that study, right? And when Jones said this in 2008, it kind of, I want to say, it put me on my ass a little bit because I was just shocked by it. He actually said that if you look at the studies on humans and animals, because he's had to quote them, part of what his research was, he said the threshold for toxic symptoms was actually 750 nanomoles per litre. So he said for safety and for cautionary, we should put that limit of vitamin D at 250 nanomoles per litre. So he's given you a margin of error of 500 nanomoles per litre. But these are the papers that we've been quoting. But it's not the case that they've been misquoted. People haven't read the actual physical papers. So once again, I'm going to link them at the bottom of the description. You can read them.
Yeah. No, I think it's a really important thing to discuss because there's such a massive fear about vitamin D toxicity in the kind of health and medical industry, but no one actually goes into detail about, well, where are we getting this fear? And like, let's look at the research and break down what's actually happening. No one can actually tell you that. They just kind of say, oh, well, it can be stored and it can cause hypercalcemia, hypervitaminosis, all these different kind of things. But we're not actually breaking it down. And something that I'd love you to mention as well before we move away from the toxicity element is the studies that were actually done on looking at administering toxic levels of vitamin D. Because again, if you actually go and try and find research that we have actually tested these toxicity levels, there's very, very little where we actually have administered extremely high doses. And the research where we have done that is shaky at best, but you can explain that better.
The study that people use a lot for toxicity is from someone...
Well, not just that they use a lot, but one of the very few studies out there that actually has discovered
you get it right
toxicity.
The very few studies.
Yeah.
It's Kular et al. Once again, link in the description. And it was based on 16 or 17 patients in India. And it was done because there was either an error in supplements, where the supplements were too high in the vitamin D, or the clinician had made a mistake and was supplementing the person 3.6 million IUs of vitamin D in 6 weeks. The Kular et al. Study literally lists the patients and how much vitamin D they were taking over 3 or 4 weeks or over a month. And it's in excessive amounts. They were literally getting intravenous injections of 600,000 IUs, right? But the study, if you actually look at it from, if you were like an ethics approval committee, the study doesn't make sense because it doesn't lay out any factors. It doesn't talk about in detail
pre-existing conditions
or anything.
Yeah.
It just instantly puts the blame onto vitamin D and says the symptoms of vitamin D deficiency, vitamin D toxicity are things like dizziness, feeling lethargic, rushing to the loo. They're all symptoms of being exhausted and low vitamin D, and
they
also
haven't actually
diabetes and things like that. So it doesn't make sense. But
also, if you're injecting like 3.6 million IU of vitamin D, like that's insanity.
Yeah.
Like if you don't get an issue, I would be concerned.
Yeah. And so it's what really kind of like bothers me is this common theme of vitamin D toxicity. And if you actually read the study, in the UK, the most reported study states that 370 patients had vitamin D toxicity. That's a very low number. That's very low numbers, right? And in statistics, that's 0.0006% of the population.
Yeah.
Do you know how low that is? To put that into context,
it's almost statistically insignificant.
And Tracey, you're correct. That's statistically insignificant. And if you look at the MHRA's guidance, right, on the estimated data for people overdosing on paracetamol, it's around 68 to 70,000 people present in hospitals with overdosing of paracetamols. So you're telling me vitamin D is dangerous?
Well, I think, interestingly, having those statistics around paracetamol doesn't stop us from having clear guidelines about what the therapeutic dose of paracetamol needs to be. Because if you need paracetamol, there's a certain dose you need to take to support your symptoms. Whereas even though the data around vitamin D toxicity is essentially negligible, we still don't have recommendations about what the therapeutic dose actually needs to be to make a difference.
Yeah.
How does that make sense?
Yeah, Tracey, you're completely right there. And, once you've all lifted your jaws up off the floor, and because I think that's a lot of information to take up, but, rewatch this, read through the data downstairs, like it's like in the description, it's downstairs in the description, and you'll see that it's not just... This is what people have been pulling off.
Yeah.
And so that narrative needs to change now. Like, we need to understand vitamin D in its entirety more, because every single study that shows the benefits of vitamin D, it's above 150 nanomoles.
Yeah.
Where your blood level's above 150 nanomoles per litre.
And this is what we need to do. We need to be having these conversations. We need as many people as possible to be reading this data, reading this research, hopefully getting even more newer studies going on around vitamin D. And this is how we make a change.
Yeah, 100%.
Yeah. I don't know if we've already covered vitamin D testing, but I think just to summarize why vitamin D testing is important, as with pretty much all vitamin testing, but really, really important to establish a baseline so we know where your levels are at, and again, associating those with any symptoms or conditions that you're experiencing. It allows us to keep track of your vitamin D levels. So we should be testing about every 3 months. And that allows us to establish, okay, what is the correct dosage to get your levels back up correctly? When have we reached the point where your vitamin D levels are optimized, so we can relook at what that dose is? Because there's going to be your therapeutic dose for kind of reoptimizing levels, and then there's going to be your maintenance dose, and those are going to be different. Testing allows us to figure out what point we need to be changing over.
What you said there is really important, because what testing allows us to do is to calculate how much vitamin D we're deficient by. Because you have to remember, vitamin D also, your body weight plays a role in how much vitamin D you need. The larger and heavier that you are, and especially in people who are athletes as well, your vitamin D needs are much, much higher, because your body needs it for muscle growth and muscle function. So that need of vitamin D goes more significant, because your body will utilize it as the active form, which is calcitriol.
Absolutely. But this just brings us into the requirement for personalized nutrition recommendations. So yes, we need to change the general recommended dose of vitamin D for everybody, but also if you're trying to take control of your health, it's really important that you are testing yourself and taking all of these other factors into consideration, because the optimal dose for you will change based on several different factors.
Yeah, 100%. And I think, as you said, like it's all down to that weight. And I'm okay to discuss about the actual calculation. I'm okay to go straight into it.
Absolutely. So let's go into now that we know all that we know about vitamin D, how do we optimize our levels?
So to optimize your levels, and I say this to everyone, test. Don't just supplement blindly, because you're probably not supplementing enough.
And you don't know the baseline. So you actually have no idea what level you are at to make you feel a certain way.
Yeah. You wouldn't believe the amount of practitioners that I've like shocked, and in some cases annoyed, because they're like, no, your test is wrong, because their levels have been so low because they're supplementing blindly. What testing allows you to do is to give you that baseline, and then based on your body weight. So now, to put this into correct, you need 10,000 IUs per 70 kilos of body weight to push your blood level up by 2.5 nanomoles. And for our US listeners, that's 1 nanogram per milliliter. So the difference between nanograms and nanomoles is just times 2.5 or divide by 2.5.
We'll put this calculation below, and basically just Google any sort of converter. You can convert those levels.
Yeah, amazing. And so what you do is you find your baseline. This is your baseline result. And then you would get your result and say, where's my target level at? So let's say for me, like I work in nanograms rather than nanomoles because it's a little bit easier. So let's say your target was 65 nanograms per milliliter. By the way, this isn't medical advice. I'm not saying to target 65. I'm just going to give you a calculation.
We're just offering information. Yeah.
And let's say your results came back at 10 nanograms per milliliter. Your deficiency is 55. You would then have that 55 number to one side, and then you would divide your body weight in kilos by 70. So for example, let's say I weighed 70 kilos. I wish 70 kilos. I would do 70 divided by 70, which equals 1, right? So then you would calculate the difference times that difference between the body weights, times that together, that would give you a number, which in this case would be, I think, 55. And then you times that by 10,000, because that's 10,000 IUs. That would give you a deficiency of 550,000 IUs. And so that 550,000 IUs doesn't mean you then go supplement 550,000 IU one go. Don't do that. But then you can divide that 550,000 IUs by the number of IUs you're going to take daily and over the number of days. So let's say, for example, you were like, I'm going to take 10,000 IU a day. Divide by 10, that's 55 days. So for 55 days, you would take 10,000 IUs. You could then retest, and I guarantee you, you would be closer to that 65. You won't be touching it, but you'd be closer. And that's because vitamin D has a half-life, and depending on where your stores are and how quickly your body utilizes it, it can be a bit lower, but you will get to those levels very quickly.
Yeah. And also, I think, so that's, say, in theory, you're living in the Northern Hemisphere, you're not getting very much sun, you're incredibly vitamin D deficient, you're supplementing specifically the 10,000. But obviously, most people can't control for all of those environmental factors. So if you happen to be going on a 3-month holiday to Spain while doing this, then that's why the testing is really important, because if you are going outside and getting loads of sun, you might adjust that supplemental recommendation.
Yeah, 100%. I mean, but T, can I just like caveat on the back of what you just said there? One of the funniest things I learned was, do you know where one of the countries where the biggest deficiency of vitamin D are being seen?
Yeah, I know.
It's Africa, the UAE, and China in like the Middle East. Sorry, what they call the MENA region.
Yeah.
Because of people hiding away from the sun.
Yeah, hiding away from the sun, but also applying sun cream.
A lot of sunscreen.
And I think that's actually an important thing to mention, because something that happens a lot when people are like, oh, you're just trying to get me to take supplements. You don't need supplements. I can get vitamin D from the sun. I think you need to remember that, yes, you absolutely can get vitamin D from the sun. And if you want to go that route
it's amazing.
There's so many additional benefits to being in the sun as well. If you want to go that route, fantastic. But I think you need to understand that if you're going the route of getting vitamin D in the sun, then you can't be using sun cream. And again, I'm not going to get into the whole thing. I'm not saying you shouldn't ever use sun cream and just go out into the sun blindly,
Before someone takes your conversation out of context.
we can talk about kind of that a little bit more, but just in the context of getting your vitamin D, you need to be out in direct sun without SPF, because that's going to block the synthesis.
I think it's anything above factor 10.
Yeah.
Anything above factor 10 will block vitamin D synthesis in skin.
Yeah. So if you're going the route of using the sun, then you need to take certain factors into context. That's why often supplements is a very useful way of restoring your vitamin D quite quickly and quite safely, and particularly if you aren't in a country where there is sun. But then when maintaining vitamin D, and if you do live in a place where you get a lot of sun exposure, you can look at different routes. But it just really depends what works for you. The main thing is that we're just trying to restore our vitamin D levels to a healthy place so that we can feel better, our bodies function better, our immune systems are functioning properly, our hormonal systems are functioning properly. And then we need to be thinking about how we maintain those levels as well, so that it's a long-term thing. You can't just, take your supplements, do your test, restore your levels, and then you're done. It's like, it's a continuous thing.
I think that's what infuriates me and you, when people are just like, oh, I went on holiday for 2 weeks, I've got enough vitamin D. It's like, it's not true. Just to add on to what you said there, what other things people do when they go into the sun is you sweat, right?
Yeah.
And when you sweat, what's the first thing you do when you get inside?
Shower.
And the minute you shower, you actually rub all that vitamin D out the skin because it still needs time to synthesize. It's not automatic. It needs time to be bound by the cholesterol and then carried by the chylomicrons to go through that synthesis and that process. So if you come back in from being in the sun at 12, 1 o'clock and you go straight in, you actually... You're washing this out the skin, and a lot of people forget that as well.
Yeah, you know what? Actually, we have a couple of tips and tricks around optimizing your vitamin D synthesis from the sun. So maybe
there's secrets to you.
But no, maybe we should do another conversation on that, because I think there are specific things to consider. It's not actually as simple as you just go out into the sun, get your vitamin D, and goodbye. There's a few things. It's not difficult, but there's a few things to consider that we don't tend to. So just before, I do think we should probably finish eventually, because we could talk about vitamin D forever.
Oh, we'll do more on this, yeah.
But you probably won't be surprised as to why we've brought out a vitamin D supplement, because we ourselves have noticed the difference of going from vitamin D deficiency to optimized vitamin D levels and what that's done for us. And so we really wanted to bring a high quality vitamin D supplement to market that could bring back up your levels as quickly and efficiently as possible, which is why we brought out vitamin D, which is vitamin D, as calcifediol, not cholecalciferol. So can you briefly talk a little bit about why we chose to bring out a calcifediol supplement as opposed to cholecalciferol? Both of these are vitamin D3, by the way. They're just different forms. So yeah.
I think it's all down to the activation. I think the
Yeah.
best way to do is actually show you on the screen, because I think we
Okay.
can go through it. So now you're going to see this on the screen. I'm going to show you how vitamin D, cholecalciferol versus calcifediol. Not even going to talk about the studies of research, but I want to talk about how it's synthesized in the system. So cholecalciferol, whether you're getting it from supplements or from foods, right? It needs to be absorbed in the intestines. It then gets pulled in via chylomicrons, attaches to that. That then goes into the liver. And then the liver does something called hydroxylation. And that hydroxylation basically converts it into calcifediol. Calcifediol then goes into the kidneys, and then the kidneys create this calcitriol. And calcitriol is where we feel all the benefits of vitamin D. So it's not cholecalciferol when you're taking that supplement. It's not calcifediol, it's the actual calcitriol.
So once you reach calcitriol in your body, that's when you feel awesome, essentially.
Basically, yeah.
And so I think just for anyone watching and maybe seeing this diagram on the screen, something that's important to remember is, so essentially what we're saying is it takes the body a lot more steps to get from cholecalciferol to feeling awesome, and it takes less steps to get from calcifediol to feeling awesome. And something that if you work in this area or you understand how the body works, you'll understand that all of these functions don't necessarily work efficiently and optimally in every person. There's lots of different reasons for that. Your general health, genetics, environment, medications, all this different stress, all of these different things that can affect your body's ability to do these conversions and work along these pathways. So for us to bring out the calcifediol version, it means that you're bypassing some of these steps and you're just increasing your chance of getting to the feeling awesome part of taking vitamin D, which is what we wanted to bring to the market because we're so passionate about how important optimizing your vitamin D levels is. Because if your levels aren't optimized and you haven't felt what it feels like to have them optimized, then you're missing out because it's night and day.
Yeah, agreed.
Is that fair?
Yeah, so just to kind of reiterate, so what happens is calcifediol or vitamin D, because of the form that it's in the system, the adipose tissue don't suck it up. It doesn't store that vitamin D.
Yeah.
And so what it does is the chylomicrons transport it straight into the kidneys. So literally, because the calcifediol's in there, the body's like, oh, I can't store this. It will take it directly to the kidneys. So it has an absorption capacity of 93%. And what it does, once it goes into the kidneys, it increases that vitamin D level, and the actual statistics show a 3.2 times faster.
Yeah.
So if you read the data on calcifediol versus cholecalciferol, it's that increase. So what you've got is, instead of if your vitamin D levels on the floor, it brings you to that increased level or from baseline much more quickly. And that's what the diagram shows.
Yeah. So it's why we wanted to bring it out. It's very effective in the therapeutic use of vitamin D. And yeah.
I'm going to link all the studies down below for the calcifediol versus calciferol. The product's going to be linked in the description below as well. And yeah, let us know any questions you have about vitamin D. And I'd love to get your thoughts on the research, because I think this conversation needs to be broached even more. And there's so much, as Tracey said before in the talk, there's so much more we can talk about. But if there's any particular research you want to send our way or you want to discuss, just leave a comment.
Yeah, I'd love to get into the details more, even about the role of vitamin D in different conditions, because I think that, I certainly didn't know before I went through my studies kind of the links between hormonal health and vitamin D, immune health, mental health, and like really what that means. So I'd love to talk about it more.
Yeah, I think we should do a recording about calcifediol and menopause, because the research on that,
it's solid.
The patent on that as well is incredible as well. If you actually read the studies and the benefits for women going through menopause, it's powerful. So thank you for today. Really appreciate it. And I'm so excited to talk about vitamin D even more in detail.
Yeah. And as we said, please do read the studies and get in touch to let us know what you think. We're just providing information out there. You know, we're not recommending that you go off and, you know, take 1 million IU of vitamin D. That's definitely not what we're saying. But read the research, inform yourself, and yeah, we hope it enlightens you the way it has us.
Thanks.
Thank you.